This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're in the Cardiac Services Department. Now, if you've ever had that feeling, maybe a palpitation or your heart is racing, that could be the sign of something pretty serious, and you're going to want to get that checked out. Today we're going to be talking with electrophysiologist Dr. Mortada about cardiac arrhythmia. Well, thank you very much for joining us today. We're talking about the heart, and we're going to specifically talk a little bit about cardiac arrhythmia and what exactly that is.
Cardiac comes from the heart, and arrhythmia means abnormal rhythm. So it's the abnormal rhythm of the heart, basically.
Yeah. And what's the most common symptom that a person might experience if they're having some kind of problem with the heart?
The most common symptom is palpitation.
And what is that?
Palpitation, basically, when you feel fluttering of your chest, that's mainly it is palpitation. And it has two types. It could be skipping beats, or it could be racing of the heart. Skipping beats mainly because of an extra beat comes from the upper part of the heart or coming from the lower part of the heart. And those are very common, but those are not dangerous in my opinion. Though the racing of the heart is basically you feel the heart is going very fast, and sometimes it can last for a few minutes, up to a few hours sometimes, or even longer. And it has multiple types as well, depends on from where it's coming, but mainly the reason for this racing is an electrical circuit goes around in the upper part or the lower part of the heart, basically.
When a person, and I'm sure a lot of people have felt the palpitation or the racing, it might be difficult for a person to determine what exactly is happening. But at that point, if we're feeling that, should we seek medical attention?
Definitely you should. Regardless, whenever you feel either a skipping beat or racing of the heart, because you really don't know what type of rhythm is this. So it's better to kind of have an opinion of doctor, either your primary physician or a heart specialist, and if the heart specialist or the primary physician felt this is something which is important to kind of take care of, they will send you to electrophysiologist, which is a rhythm specialist like myself.
Okay. So at times it may not be something that's dangerous, but if it is dangerous, I mean that could be a life-threatening issue.
I will say most of the time, if you do feel the skipping beats, which is an extra beat originating from the upper part or the lower part of the heart, usually is not very dangerous. Usually it's bothersome. So we can treat it, just depends on your symptoms. Though the racing of the heart, that is the one which could be dangerous, depends on the location where this is coming from. When we see the lower part of the heart going out of rhythm, that is the time when we have to do action. We have to find out why it is, how we can fix it, and how we can save a person's life.
Right, and then how do you treat that? How do you fix that?
Three options of treatment usually for rhythm problem. First option is medication. The second option is something we call ablation. We do complex electrophysiology study. Basically, we put catheters inside the body, and I have an example of one of the catheters. This is a catheter. We put it through the veins, and you can see at the tip of the catheter there is multiple electrodes, those to measure the electricity of the heart. And as soon as we find out where is the electrical circuit, we'll be able to reach to that spot and do what we call ablation. Ablation basically is cauterizing that tissue or burning that tissue to completely destroy it and cure the person's rhythm forever, I would say. This is an example of a supraventricular tachycardia, or an electrical circuit in the upper part of the heart or in the atrium. As you can see, the heart has two upper chambers. Those two we call the atrium, and those two we call them the ventricles. And you can see there's an electrical circuit going around in the right atrium. This is an atrial flutter. Going very fast. Here I slow it down, but actually it's going 300 beats a minute. And that makes the lower part of the heart as well goes very fast and cause multiple issues like a stroke or weakness of the heart and symptoms of the palpitations. Therefore, the best treatment for this type of rhythm, sometimes we give a shock, but most of the time we bring a patient to the operating room, like this room, and we do the ablation. And this is an example. The second slide will show you the ablation. We have multiple catheters in the heart, as you can see. And in the bottom, we say line of block. We put the ablation catheter in this area we call the isthmus location. We burn spot by spot until we create a linear lesion, and that linear lesion will prevent the electricity from going through that lesion, and that will prevent the circuit from continuing to go around and around.
Very complicated, but it's certainly life-saving procedure, isn't it?
Very, very life-saving procedure, and as well as patients will feel much better as far as for their symptoms, and they'll live a good life.
And that's what it's all about.
Perfect, exactly. The third option of treatment is meant for people who had ventricular tachycardia, which is the lower part of the heart, which is the dangerous rhythm. And that's usually being treated by implanting a defibrillator like this one. We put it underneath the skin, which has a wire goes inside the heart, and that will be monitoring the heart 24/7. If there is no bad rhythm, it will do nothing. But if there is a bad rhythm, then this will give a shock and bring a patient's life back to normal.
And that's what it's all about.
That's all about.
Well, thank you for taking some time with us today and explaining
Thanks
this.
a lot. Thank you.
Now, if you have any questions regarding heart palpitations or racing of the heart or anything regarding cardiac arrhythmia, you should get a hold of your primary care provider, or you can get a hold of Dr. Mortada's office at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.